I'm John Saltzman, Director of Endoscopy at the Brigham and Women's Hospital in Boston and Associate Editor of GIE. I'm speaking today with Dr. Deepak Agrawal, who is at the University of Texas Southwestern, and will be speaking about his article, A Perspective on the Use of Water in Endoscopy. Tell me about what you wrote about.
Yeah, so this is a paper on what kind of water we should be using in endoscopy for irrigating the GI lumen. It's very interesting how I came about writing this thing. I was doing a colonoscopy about a year back, and it was a particularly dirty colon, used up a lot of water, and we ran out of water, and the nurses kind of scampered around trying to find sterile water. Mm-hmm. And I said, hey, there's a tap there, why don't you just fill it up? And they said, no, we have to use sterile water. And I said, hey, it goes in the colon, this full of stool. And they refused. And that set me thinking as to why we are using sterile water. So, I asked quite a few nurses, where does this practice come from? And they said it's policy. Mm-hmm. And some of them were worried about infection risk. So that's when we decided to look at policies.
I see. And is there a national policy that recommends sterile water versus tap water?
Yeah, so for GI, we mostly follow a lot of society guidelines, and I looked at different society guidelines. The ones that commented on use of water were ASGE, mm-hmm. That we all are familiar with, and SGNA, which is the Society of Gastroenterology Nurses and Associates, yep. And SHEA, which is SHEA, Society of Hospital Epidemiology of America. And they all did recommend use of sterile water. So it was very interesting.
What is the difference between sterile water? Is sterile water really sterile, and is tap water not sterile?
So tap water is more like potable water, and it mm-hmm. can contain bacteria. And sterile water, by definition, would be like devoid of any bacteria. So, but mind it, the potable water or the tap water is the water that we drink every day. Even the immunocompromised people, drink that water. So it contains bacteria, but probably not in sufficient numbers, and they are non-pathogenic bacteria.
Mm-hmm. Are there studies that have been done suggesting that sterile water has better outcomes than tap water, or what is the scientific basis for this?
So, talking about the scientific basis, yes, the first question is, are there any studies? And the answer is yes. People have actually looked into that. And why do societies suggest that? So ASG, in their paper, when they say that you should use sterile water, they cite a paper from Lawrence Muscarella, which was, I think, written in 2006 or so. In that paper, he does not comment on use of sterile water. It's a paper on disinfecting the endoscopes and properly drying them. And we personally communicated with him. I said, does your paper suggest anything about sterile water? And he says, absolutely not. Mm-hmm. And then some of the other societies like SGNA and SHEA, they quote papers from APIC, which is Association of Professionals of Infection Control. And the basis of all these recommendations comes from two papers, one in 1974 and the one in 1978. And these papers looked at disinfection of endoscopes with agents like ethyl alcohol, glutaraldehyde, iodine, none of which we use now. Mm-hmm. So, and it was, you can't conclude anything from these things, and yet papers from 1970s form the basis of our recommendations now. So regarding your other question, are there any studies about it? So people actually talk about it, and I think it was 1996 and 1997 where Dr. Wilcox actually conducted a study. So he used bottles, filled it up with tap water, filled it up with sterile water, and drew cultures from them at the end of the day or after the end of 1 week. In fact, they used the same bottle for almost a week, found no difference. Kind of 25% of bottles from each arm, like either sterile or tap water, grew some bacteria. And there were no adverse patient outcomes.
So is there a downside to using sterile water?
Yes, if you talk about costs. Mm-hmm. So the costs to the financial cost, the cost to the environment, and I think the unhidden cost of we not practicing evidence-based medicine. So in terms of the financial cost, we all are trying to save money. It's we sometimes choose things which are probably even $10-15 less, or we choose forceps which cost maybe $2 less.
Mm-hmm.
And at our unit, we spend about close to $2,000-2,500 on just sterile water alone in a month.
Mm-hmm.
Our endoscopy performs about 30 cases a day. So it's not inconsequential, the amount of money we spend on this thing. The second is the cost to the environment. You dispose it off. This is all plastic. You put it in. Most of us put it in regular trash, but some of them are putting in biohazard bins. So regular trash goes to landfills, takes years to decay. The biohazard gets incinerated or autoclaved, which releases like bad things like dioxins, furans. So we should be more environmentally conscious about these things.
Mm-hmm. So can you maybe summarize what your thoughts are about this area?
Yeah, no. What we want to do is, it's clear that what we are doing is not evidence-based. There
Mm-hmm.
is literature that it is safe, and it defies all logic. I mean, you drink tap water, but you inside the colon, which is full of stool, you're putting in sterile water. So first of all, we have to start asking why we are doing it. And the answer is policies. So different societies, ASGE, SGNA, SHIA, we have to use our powerful platform to educate people. Ask ourselves, do we need more evidence, or do we have enough evidence to say, let's change the guidelines, let's at least encourage people to think more logically. So that's what I hope will happen, and there will be cost savings.
Now, do you think there already is enough evidence to perhaps change the tap water, or do you think there are more studies that need to be done in this area before we can make that determination?
I personally believe we have enough evidence,
Okay.
but it will be, when people sit in a boardroom and they may think differently. And if they think more evidence is needed, I think they should try to fund some studies.
Mm-hmm.
The problem would be designing a study. I mean, we know that there will be no adverse patient outcomes, so how do you do that? The study will involve like staggering numbers, and I'm not sure how this study will be conducted, but we have a few protocols in case they are ever interested. We'll be happy to participate.
Well, thanks for talking. That was very thought-provoking today.
Thank you, Dr. Saltzman.